Good afternoon, and thank you for joining us. This briefing is being aired live on YouTube. A reminder to maintain audio quality, to please keep your phones on mute until it's time to ask your questions. If you are able to do so, please use *6 to mute and unmute your phones. Joining us for today's media briefing are Dr. Ryan Westergaard, Chief Medical Officer with the DHS Bureau of Communicable Diseases, and Dr. John Myman, the Chief Medical Officer for the DHS Bureau of Environmental and Occupational Health. And we'll begin the briefing with remarks from Dr. Ryan Westergaard.
Good afternoon. Happy to be here today together with my colleague Dr. Myman in the Division of Public Health to provide some updates about our new and ongoing strategies for testing related to the COVID-19 epidemic in Wisconsin. We've talked a great deal about testing for COVID-19 as one of the main and most important elements in our public health response. Generally, when we've discussed testing in the past and when we report the numbers of tests that we conduct and the number of positive tests and the percent positives, what we're talking about are diagnostic tests, tests that are used to diagnose someone with COVID-19 because they're symptomatic or because they're in contact. This is the most important kind of testing because knowing when a person is sick with COVID-19 as early as possible during their illness and getting those individuals into isolation is the number one priority for preventing the spread of the disease. But testing people who are symptomatic with diagnostic testing isn't enough to help us understand the complete picture of the epidemic. Some people can be infected and not have any symptoms. There haven't been enough tests all the time to go around that every person in every community can get a test when they develop symptoms. And diagnostic testing only shows us the tip of the iceberg, if you will. If we want to more fully understand the spread of COVID-19 epidemic in the past, we have to use a variety of tools and collect different kinds of information to look at the epidemic from a number of different perspectives. So today we're pleased to be able to describe two new public health projects that will help us better track changes in the epidemic in Wisconsin in the coming months. I'm going to briefly describe the first project, which involves antibody testing, and then I'll turn it over to Dr. Myman, who is going to talk about an interesting strategy for detecting virus in wastewater. So the first new initiative, we've given the name the Past Antibody COVID-19 Community Survey, or PACS, P-A-C-C-S. The word past in the title refers to the goal of this project, which is not to understand how many people are infected right now, but to understand cumulatively how many people have been infected since the start of the epidemic. And we do that by using a type of testing called antibody testing. So different from the type of testing that detects the presence of virus in a swab collected from the nose or the throat, antibodies are a blood test which measure the body's response to the infection at some point in the past. So the benefit of using an antibody test is that they tend to stay positive for a longer period of time. So if we do this in a strategic way, we can understand what has been the burden over this first 6 months of the epidemic. So the way that we're going to approach this is through a partnership between DHS and the University of Wisconsin School of Medicine and Public Health, who operates an ongoing study called the Survey of the Health of Wisconsin, or the SHOW, in an additional partnership with the Wisconsin State Laboratory of Hygiene, which will be conducting the antibody tests. The goal will be to recruit volunteers in 10 counties around Wisconsin using the infrastructure that the SHOW study has established through previous research over the past 10 years. Volunteers will provide a blood sample, which will be tested for antibodies, and then in an anonymous way, we will analyze these specimens to know how many people have been infected cumulatively in strategic areas of the state. The testing will be performed at the State Lab of Hygiene starting in June, and we will do subsequent waves for a year, every 3 to 4 months, to understand how has the epidemic changed over time. The study doesn't provide information about current positive cases. It's not an alternative to diagnostic testing. In fact, participants in this survey will be screened for symptoms, and if they have any symptoms suggestive of COVID-19, they will actually be directed to a diagnostic test, a molecular test, to see if they're infected now. The idea here, again, is to understand how broadly has the epidemic spread during the first 6 months of the epidemic, which will give us some better information to understand how to prepare for the future and to know what communities have been harder hit as we continue to learn more about this. So with that, I'll turn it over to Dr. Myman to describe our other new initiative.
Sure. So as Dr. Westergaard mentioned, what we're trying to do is get the best, most comprehensive understanding we can about the state of the transmission of this virus here in the state. And one other novel approach that's being looked at both here and in the United States and also in countries around the world is actually looking at wastewater. So when people are infected, oftentimes the virus will end up in wastewater, and you can analyze that water to determine how much it may be circulating in the community. And this has been used historically for viruses like hepatitis A or norovirus or even polio. And so there was interest in trying to use some of these methods early on during the COVID-19 outbreak in several European countries to see if they could detect outbreaks early. And so even though these methods are new and they're evolving and we're still having to do a lot of research, they did find, at least in a couple of European countries, that they could actually detect it in the wastewater before they detected it in people through a standard diagnostic test. And so with interest in this type of testing growing around the world, there have been a number of states that have undertaken this, and what we want to do here in Wisconsin is bring these methods, some of these very novel approaches to surveillance here to provide, again, yet another picture to all the other testing that we do to get the most comprehensive understanding of transmission. So the plan at this point is to really focus on the counties with the most people. So by focusing on just about 20 counties, we can probably assess somewhere around 3/4 of the population of the state. And by testing that wastewater on a very routine basis, maybe about every week or so, the goal is going to be able to look at the amount of virus in the water and determine, is transmission actually increasing? Is it decreasing? And does it match up with our testing from people? And that should provide yet another way to validate what we're seeing through our traditional testing. The other part of this project will be to test a much broader sample of wastewater systems across the state. These may be rural areas where there isn't much transmission, or at least we don't know about it, or there may not be much testing of people. And by testing those on a less frequent basis, we may get an idea of emerging hotspots or areas of transmission before we've had a chance to detect it through our more traditional ways. And in doing so, the goal is to be able to focus public health resources and focus our response more quickly to bring the disease under control as quickly as possible. So this, like the other project that Dr. Westergaard mentioned, this is an exciting collaborative project, not only with the Department of Health Services, but also with the Department of Natural Resources, and it's being spearheaded by the Wisconsin State Laboratory of Hygiene, who will be working very closely with a researcher at the University of Wisconsin in Milwaukee. So over the next few weeks, they will be continue to develop their methods for testing wastewater with a goal later on in the summer of doing much more routine testing. And at that point, we'll work on communicating these findings to the public in a way that's understandable and translatable, and then also providing it to our local public health partners so they can use it to inform activities in their jurisdiction.
Thank you. We will now open it up to questions. A reminder to maintain audio quality, to keep phones on mute until it's time to ask your questions. And today we will be allowing 2 questions, or a question and a follow-up per reporter. And we'll begin this afternoon with David Wahlberg from the Wisconsin State Journal. David?
Hi, Dr. Westergaard. I have a question about antibody testing. I got some data from the Madison area health system, and they said that among about 17,500 people tested at those systems, 2.4% tested positive for antibodies. I'm wondering, what do you make of that? Does that seem high or low, or what implications can be drawn from that? And then also, do you have data for other parts of the state or the state as a whole so far?
Sure. Thanks, David. It's a good question. So the goal of antibody testing, again, is to kind of get another source of information. It's not the only or the true answer, but it's another perspective on the number of people who have been reached or infected over time. So by looking at antibody tests conducted in healthcare settings, it can tell us a number of people in those settings that have been potentially infected in the past. And the proportion of 2 to 3% seems relatively in line with what we'd expect based on reports from other countries. One country that did this on a large scale in Spain, which had, as some people know, a pretty severe epidemic early, found that even though they had one of the worst epidemics in Europe, it was still about 5% or less. So I think that level of 2 to 3% being positive in healthcare settings is not unsurprising. The difference what the new study is going to be able to tell us, though, is to try to get a less biased estimation of the true prevalence. And what I mean by that is by testing in healthcare settings. If we're testing for a disease and you only test among people who show up in hospitals or clinics, you're going to be disproportionately studying people who have symptoms or are sick for some reason. Sick people go to the hospital more than people who don't have any symptoms. But the idea with the SHOW study is to, in a more systematic way to assess the general population in a way that's not biased on who shows up for healthcare or who works in healthcare. So it'll be another piece of information related to this. In terms of what it teaches us, I think we're expecting and hoping that it's going to show us that it's a relatively low level. 1% or less would not be surprising. But not knowing what the future holds, knowing that there's going to be a wave of respiratory illnesses like there is every year in the fall with influenza and other respiratory viruses circulating, doing this periodically, we can see the effect that this epidemic is having going forward. So it'll help with our future planning related to understanding how the response and the effectiveness of our strategies.
Thank you, David. Now to Bob Haig from Wisconsin Radio Network. Bob?
Hi, thanks for having this call. Unrelated to today's topic, but as you look at what's happening in states like Florida, Texas, and particularly Arizona, are you concerned that it's a preview of what we could yet see here in Wisconsin? What do we need to be doing to avoid that sort of outcome?
I can start with that one. So. There's new waves of, new clusters or new clusters of cases in other states, which happen to be states that also have relaxed some of the social distancing interventions, as we know. Whether that predicts or is a preview of what we experience in Wisconsin, I think remains to be seen. Our stay-at-home order has been, not in effect for over a month now. We saw a small increase in cases and hospitalizations in the second half of May, but as of now, the first part of June, our cases are lower than they had been, and we're not seeing a large wave. So I think the biggest determinants of what the epidemic looks like in the months ahead are the success that we as a community, as a population, engage in these protective behaviors. Physical distancing and wearing masks are probably the two biggest ones. So even though other states are experiencing epidemics, I think we in Wisconsin, if we can communicate and coalesce around the idea that adopting these infection prevention strategies like wearing masks in public and maintaining physical distancing in public, I think there's a lot of good that can be done. So it's not a foregone conclusion that we are going to have a wave. There's a lot we can do to prevent new cases going into the late summer and fall.
Thank you, Bob. Now to Jim Melowitz from Wisconsin Watch. Jim?
Hi, thanks for having the call. I was wondering, with this new tool being unveiled to test wastewater and get a better sort of a sample of who has had the disease, does the messaging on testing change at all for sort of the individual people who are deciding whether or not to show up to testing sites? And what exactly is the most updated message for folks wondering if they should test, including people who might not have symptoms but might have exposures?
Yeah, I can at least start with that, and then I'm sure Dr. Westergaard will have something to add as well on the testing front. But no, I mean, testing wastewater is just a way to supplement what we're already doing. It's just another way to get a better sense of what transmission may be occurring in the community. And its potential utility is the fact that it doesn't really depend on gathering information from any other source. It's kind of a way to get a snapshot in time from a whole population that's served by a particular system and see if that it is circulating. But it is in no way a substitute for diagnostic testing, which is what we use to provide people recommendations about isolation and quarantine and all the other measures that they need to do.
That I'd add that our recommendation about who should get tested hasn't changed fundamentally, but I think we're more comfortable saying that anybody with symptoms of a respiratory illness, cough, fever, sore throat, runny nose, the common cold, should feel encouraged to get a test. Our overall laboratory capacity is now quite large in compared to the number of tests we're doing on a day-to-day basis, so that's not a limitation. And we want to encourage people who sort of want to normalize the idea in ways that haven't been true in the past. In this, the coming year, people with respiratory symptoms, people coming down with a cold or flu-like symptoms should get tested. Even in the past when that hasn't been the case, because we know that a common cold will run its course in a week or so. Going forward, we want to encourage people to get tested because it's very important that we identify cases of COVID-19 early, which allows us to do our containment strategies and get people protected.
Thank you, Jim. Now to Ryan Curry from NBC 26 in Green Bay. Ryan?
Hi, good afternoon. Thanks for having this call. My question is kind of piggybacking off an earlier question about the rise in cases in other states. Is there anything Wisconsin is prepared to do in case a trend resolving that of Florida or Texas starts to get shown here?
Well, I think our strategies are pretty flexible and pretty responsive to local changes. Right now, the tools we have are expanded testing. When we find cases, doing detailed investigations, finding people who are exposed, putting those individuals into quarantine, and paying particularly close attention to infection control and healthcare settings and other things. So those things don't fundamentally change. As we get increased cases, we just have to do them faster and better and at a higher volume. So our work that we're doing in preparation for that is just to build our capacity, to have surge planning for our contact tracing workforce, to make sure that we have enough testing to handle it if we did get a phase. So no, the tools are the same. We just on an ongoing basis are preparing to be able to do them on a larger scale.
Thank you, Ryan. Now to John Doran from WLUK TV in Green Bay. John?
Hi, thank you. This is also sort of piggybacking off that same subject. Safer at Home has been rescinded for about a month, and the numbers have been pretty flat, like you mentioned, at the beginning of this month, through June. Is there something you can specifically attribute that to? I know there's been emphasis on wearing masks or businesses really taking the input to heart they're getting from public health officials. Was it something, community testing done in our state? Did that have something to do with it? And looking at those numbers, does that give you some confidence that we're not done with, or we're not through with COVID-19, but, maybe we're confident we have it under control at least a little bit? Thank you.
Sure, I'll just at least start with the end part there, which is, we're not done until we're highly confident that we have this contained. While the trends are encouraging, we still have a lot more work to do. But I hope is that what we're seeing is some of the success of all the work we've been doing over the last few months, we as a state. And that comes down to personal behavior, to employers doing whatever they can to put in the things to protect their workers, to public health at the local level, making sure they get the messages out to the community on the things they can do to keep them safe.
Thank you, John. Now to Sean Kirkby from Wisconsin Health News. Sean?
Hi, thanks for holding this. Just a nuts and bolts question. How much are these studies going to cost, and what is the funding source for them? Thank you.
So the antibody tests are inexpensive compared to the molecular test, but I can't quote you the precise amount. I can happy to get back to you on that. The funding source for this project comes from federal funding administered through CDC to support the overall public health response. So we are administering it through the state, but the ultimate source of funding is from the federal source, and it's being implemented through our research partners through the University of Wisconsin system.
Thank you, Sean. Now to Jessica Van Egren from Up North News. Jessica?
Yes, thanks for taking my call. I have a quick question about the antibody testing. Dr. Westergaard mentioned that you guys would be recruiting volunteers in 10 counties throughout Wisconsin. Wanted to know if you've chosen those 10 counties and if it's going to be a rotating group of 10 counties or always the same ones. Thanks.
Yeah, thank you. The counties have been selected based on the fact that this is an ongoing research project that's been funded for about 10 years or more through the Wisconsin Partnership Program. So there's been a sort of a wide range of topics that have been addressed through the Survey of the Health of Wisconsin, and they've been doing, I think, up to 4 different rounds of data collection in these counties. I can't list the specific ones, but they're available on the show website, and we can follow up by email. But there will be some rotation among those 10 counties, but the advantage of doing the study this way is that there's an existing infrastructure and partnerships with people for a specimen collection, and an existing pool of individuals who have already volunteered for other studies. So it made it much more doable in a shorter period of time to use the resources that have already been developed for this community-based research project.
Thank you, Jessica. Now to Will Cushman from WisContext. Will?
Good afternoon. My question is also about antibody testing. My understanding is that antibody testing carries a risk of kind of resulting in a lot of false positives when it's done in a population with low prevalence for the antibodies that are being tested for, which is what sounds like this study sounds like it could be a risk of this kind of community-wide surveillance study. The CDC recommends in these situations that a positive antibody result be followed up with a separate independent antibody test. And I'm wondering if that's a protocol that will be included in this study design. And I'm also wondering which manufacturer or manufacturers you've settled on, if you have settled on manufacturers for antibody tests.
Sure. Thanks. Well, I'll do the best I can for those questions. So there are a lot of different manufacturers for antibody testing. One of the things we've talked about during this response is that there was a proliferation of relatively low quality antibody test kits that came to the market a few months ago. But more recently, the antibodies tests that have been developed for the larger instruments that are being used for other diagnostic purposes in tests, including at the state lab, have been improved to the point where I think the sensitivity of the platform we're using is 99.6%, so a false positive rate of 0.4. So it's true that no test is perfect, and in a very low population, some of the people who test positive will be falsely positive. The test we're using, I think, is the Abbott Architect platform. As for the protocol about whether these tests will be followed up, because this is being done as not as a diagnostic test, meaning we're not doing this because we're suspicious people have the infection. It's rather being done as a prevalence survey. We want to know what is the prevalence of antibodies in the study. There's not going to necessarily be any follow-up other than if it's not directed by the fact that the patient has symptoms or questions. So the participants will be given their results and what they mean. The other thing to know is that people will be screened. If they seem like they might be sick right now, they'll not be asked to participate. They'll be linked to care and testing for diagnostic purposes. So it really is, it's not done for research purposes per se, meaning that's not the primary goal, but it is sort of embedded in a research type protocol where it's really done to collect information that's useful for the population level. We're not doing it necessarily to evaluate, to give people medical advice, and specifically want to not have the expectation that it's diagnosed illness that they have right now.
Thank you, Will. Now to Rachel from TMJ4 in Milwaukee. Rachel?
Hello, just looking for a little more clarification on the question about the volunteers. So the volunteers have been already selected through those other studies, or if not, when will those tests for volunteers, I guess, how will you pick the volunteers and when will that start?
Sure. So several thousand Wisconsin residents have already participated in the SHOW study in one of the previous waves. And many, I believe most of them, have given permission to the research team to contact them for future opportunities for study. So that is the pool from which the new volunteers will be taken. The advantage of doing it that way is again, it's not people who are seeking healthcare because they're sick. It's people who have been selected because they live in a specific community, trying to get representation of the overall population.
Thank you, Rachel. Now to Megan Hart from Wisconsin Public Radio. Megan?
Hi, thank you. This is kind of unrelated, but I'm wondering with UW-Madison announcing its Smart Restart plan, if you have any concerns about students returning to campuses this fall, given the large increase in cases some counties are seeing among young people.
So I think, yeah, we both have concerns. I think everyone has a lot of concerns. You know, this is uncharted territory. As one of the previous callers alluded to, like, we've not eliminated the virus. It's still circulating at a low level in the community. And when people come, people tend to get to congregate in close places, particularly indoor places. That's a risk for transmission. So I know the university released today a very well thought out strategy after consulting with a lot of people on how they're going to resume classes in a safe manner. We're at the state level and the county level supporting all educational institutions to try to do that as best we can. But there's always going to be a risk, and we need to be prepared to respond and investigate clusters and try to contain outbreaks if and when they happen. I think the other strategy that we're really working for is the better we can do containment this summer, right now, the better we can drive down our numbers of new cases, the lower the risk of local epidemics flaring up. So there's a lot of planning going on, but yeah, I believe everyone's concerned that it's going to be harder to contain an epidemic when people start gathering and other respiratory viruses start circulating.
Thank you, Megan. Now to Scott Bauer from the Associated Press. Scott?
Yeah, hi, thanks for doing this call again. So I guess kind of piggybacking from that last question, as we look ahead to K-12 schools, most of them have not decided yet what the fall is going to look like. Do you feel like it's possible or advisable for those schools to resume in-person classes?
So I can start. I mean, this is a question not only that Wisconsin is grappling with right now, but it's every state's grappling with the same question, because it's not just a matter of containing the disease. It's also all the things that come along with school. So we also have to take in mind the fact that it gives parents the ability to work during the school year, lost education when kids are out of school. So we have to try to look at all of those things together. One thing that we're looking at really closely right now, and we're working very closely with the Department of Public Instruction, are putting in measures as best we can in schools to make sure that the virus is not introduced, but if it is, and when it is, just like what on a college campus, that we detect it as early as possible and have those measures in place to prevent it transmitting as best we can within kind of that school population. You know, the other aspect of this, and this is an area of just emerging research, is just how susceptible children may or may not be. And some of the research that just come out this week suggests that they're, you know, much less susceptible than adults to getting the infection. So while there's still a lot more research to be done, I think some of the initial findings are encouraging, and it will certainly inform, you know, what we will recommend as we move into the fall.
Thank you, Scott. Now to Melanie Conklin from Wisconsin Examiner. Melanie? And a reminder, *6 to unmute your phone. Melanie Conklin from Wisconsin Examiner. Okay, we'll try to get back to Melanie in a bit. We'll now go to Danny Maxwell from WKOW-TV in Madison. Danny? Danny Maxwell? Okay, moving on then to J.R. Ross from West Politics. J.R. Moving on then to Emily Davies from WSAW-TV in Wausau. Emily.
Good afternoon. So my viewing area is the north region of Wisconsin, from as far south as Adams County to as far north as in kind of that strip going north. And I understand that both of these studies are going to be focused on the more populated areas first. So would you be able to walk through, for both studies, when the people of the north central Wisconsin region can expect to have research about their area?
So first, for the antibody study that has, I'm sorry, I was trying to look through my notes to be able to list the counties. I have a map, and we can share this with you offline to show which counties have participated in the past. But the goal there is really to not, to get geographic representation. So to specifically select counties throughout the state, so we don't leave any rural counties behind, for example, really to get a representative focus. So for the antibody test, it's going to be starting in this month for the next several months. I don't know the order in which the specimen collection people will be contacted in the specific counties, but there is a goal to sort of have it be geographically representative, and we can get back to you on the specific counties involved.
As far as wastewater testing goes, as I mentioned, there's going to be a focus kind of on two sets of treatment systems. One are the largest ones, so we can capture the largest population with as few samples as possible. But the other part of that kind of gets to what you were asking, which is trying to get a sense of what's going on in the more rural counties. So there certainly will be a number of smaller wastewater systems geographically selected across the state, so we can get a better idea of what's going on in these rural areas where maybe not as much testing is happening, or maybe there's just not as much circulating virus, again, to give us a better picture of what's going on in areas that appear to be quiet. So kind of twofold parts of the wastewater testing, getting that good geographic spread, but also focusing on the large population centers at the same time.
Thank you, Emily. Now to Chuck Kornbach from Milwaukee Public Radio. Chuck?
Good afternoon. Sort of on antibodies. Can you talk a little bit about why are people recovering from COVID? Is it antibody production? What are the key factors that, quite a few confirmed cases people have recovered?
Well, antibodies are one part of the body's immune system among others. So in response to any foreign protein, whether it's a bacteria or a virus, the body generally makes antibodies in response. Sometimes those antibodies play a large role in neutralizing the infection and preventing it from doing damage to the body, and sometimes less so. So there are other blood cells called lymphocytes and a whole range of white blood cells that are part of the body's response. There's a lot that we're still learning about why some people have more severe illness than the others, but generally the immune response to viral infections involve antibodies and other aspects of the immune system.
Thank you, Chuck. Now to Courtney Garish from Spectrum News 1. Courtney? Spectrum News? And a reminder, *6 to unmute your phones. Courtney Garish? Okay, we'll move on then. Let's actually go back to see if Melanie Conklin from Wisconsin Examiner is with us. Melanie? Moving on then to Danny Maxwell from WKOW. Okay, then our final question of the afternoon belongs to Brittany Ehrman from WMTV NBC 15 in Madison. Brittany?
Hi, this is actually Michelle Beck filling in for Brittany Ehrman. But my question is, with concerns over this second wave coming in the latter half of the year, do you have any numbers that you guys are projecting over at DHS? Is there a kind of good number, like a threshold almost, that suggests, whether or not our state is okay in terms of, how the scope of this pandemic?
Well, I'd say our goal is containment, which means cases are very rare. I think if we experience the level of spread of COVID-19 that we do for influenza every year, that could translate to a large number of hospitalizations, a lot of serious illness, and could really be a stretch to our health system. So that is we find unacceptable. It doesn't mean it won't happen. I mean, we could have a very serious respiratory virus syndrome season. But I would say our goal that we're still taking seriously right now is to be able to get the number of cases low enough to the point where every case is followed up quickly and isolated, and that would be relatively low. So the lower the better. 0 would be ideal. I guess from my perspective, that goal is not impossible. We're having 200 cases per day now in the state. As we're building our capacity to respond to outbreaks, to do quarantine, it is not impossible that we could contain the number of cases and drive it down further. It requires a lot of cooperation between healthcare partners and public health partners and the public to really commit to these activities of staying home when you're sick, getting tested immediately. It's a huge challenge, but where we are right now in the epidemic, we shouldn't stop hoping and planning and striving for the situation where we can contain local epidemics and keep the prevalence of this very, very low. So that's still our goal.
Okay, thank you, and thank you for joining us for today's media briefing. Any additional questions can be directed to DHS Media at dhs.wisconsin.gov, dhsmedia@dhs.wisconsin.gov, or you could call the media line at 608-266-1683. Please continue to monitor the DHS COVID-19 web pages for information, data, and guidance. Thank you, and have a good afternoon.